Hi everyone, my name is Tanya and I also work for the Odyssey vocabulary team, and I'm also a psychiatrist. And so today I'd like to propose you an idea of a comparative effectiveness study for antipsychotics. So the psychiatric field today can be imagined as this sort of an iceberg where on top you have these cutting edge studies of novel drugs with a new mechanism of action. However, if one would look into the guidelines, these ones and many more, they would find that there is actually lots of this uncertainty underneath the water because they do not provide clear or whatever guidance on the first choice of a drug for first episode psychosis. And those guidelines, which actually do provide some choices from the big group of antipsychotics, do not provide really clear evidence on why these drugs were chosen exactly, except for the idea that treatment adherence should be key. Guidelines talk about lack of head-to-head comparisons, about heterogeneity in clinical trial designs, and overall inconsistency of findings. And by the way, this choice of first medication during the first episode psychosis is a crucial choice in patient's life because it affects both treatment adherence and thus overall disease pathway during the patient's life. And so I was thinking, how do we capture the treatment adherence as well as the efficacy of a drug? And I came up with the idea of rehospitalizations as a good proxy for both of those factors and many more. And so if we put the study question in Odyssey terms, this could sound like this. In patients with first episode psychosis, does exposure to, for example, antipsychotic A have a different risk of rehospitalization within the following 6 months relative to antipsychotic B? And so we would have targets and comparisons, different antipsychotics. We would have an indication of first episode psychosis. We would have an outcome of rehospitalization, and we would also have a time at risk of 6 months. And by the way, it is not chosen arbitrarily here because reoccurrence of psychosis during the previous 6 months is actually one of the diagnosis criteria for schizophrenia. And so hopefully this would make the choice of medication for both clinicians and patients easier by narrowing down our choices from a huge pile of different antipsychotics with different mechanisms of action down to just few, the most efficient ones. So hopefully this caught your interest. And if you're interested, please feel free to reach out to me via the forums or my email. And thank you for your attention.